Welcome to my channel Health for You. Common skin changes during pregnancy. For some of us, it's all about the healthy glow, but for others, pregnancy comes with a side of skin issues. Everything from rashes and stretch marks to extra sweat and darkened skin. Most women experience some kind of change to their skin when they are pregnant, and it differs from woman to woman. In fact, it can even differ from pregnancy to pregnancy. The good news for those who experience skin changes during pregnancy is that most of them disappear after you give birth. Stretch marks, described as tiger strips or badges of motherhood. The medical term for stretch marks is strigarvidarum. They appear when the underlayer of the skin breaks in areas to create red, pink, purple, or brown marks depending on your skin type. A large component of the underlayer of the skin is made up of supportive protein fibers called collagen. During pregnancy, the hormone relaxin contributes to reducing the amount of collagen fibers in the skin, making these fibers more susceptible to breaking as the skin stretches, especially if this happens to a faster rate than new skin cells can reproduce. Stretch marks will appear. Stretch marks can appear on your belly as early as 16 weeks and on your breast, thighs, bottom, and upper arms at any time. After having your baby, stretch marks will usually fade to a silvery white color. There is no hard evidence that any cream, diet, or emollient will prevent stretch marks. Some women take every precaution and get them, while others take none and don't get any. If you want to use a lotion, Soroboline and vitamin E creams appear to be as effective as any other remedy and are certainly softer on the hip pocket. Rashes during pregnancy. Many women will develop a generalized pregnancy rash all over their belly and different areas of their body. This can sometimes be referred to as PUPPS, uteric areal papules and plaques of pregnancy, and is annoying but normal and will go away after Bubs is born. If the rash is severe and ongoing, you may need to see your caregiver to rule out other possible causes such as sebaceous, eczema, or a fungal infection. Itchy skin during pregnancy. You may be more susceptible to itchy skin if your skin is dry, particularly in the winter months. As the pregnancy continues, the stretching and growing of your skin can aggravate itching sensations. Persistent itching, particularly after 20 weeks of pregnancy, may be a sign of poor liver function. This is called cholestatic jaundice of pregnancy or cholestasis, and it diagnosed with blood test. Your caregiver is likely to recommend you have these tests as a precaution if you experience constant itching during pregnancy. This is particularly so if you are itchy on your palms or the soles of your feet. There are plenty of ways to treat itching. Using oatmeal or emollients in the bath or shower is a popular choice. Other options include using sorbeline and glycerin creams instead of soap for cleansing. Soaps and perfumed skin products should ideally be avoided. Wearing as little underwear as possible. Try cotton clothes instead of lycra and synthetics. Changing laundry detergents to one with no dyes or perfumes. Using pawpaw ointment or calendula cream. Some women find chickweed ointment helpful as an alternative, while unslightly good old calamine lotion will relieve a stubborn itch. If the itch is really unbearable, some caregivers will prescribe antihistamines or steroid creams to be used very sparingly when in dispersion. There is some research that shows small doses of aspirin can be effective, but this can thin the blood and reduce its ability to clot well. You should only take aspirin during pregnancy if medically prescribed. Dark spots during pregnancy. There are many areas of your body that can noticeably darken during pregnancy. Patches on your face, also known as the mask of pregnancy or chlamydia, nipples, the skin under your arms, between the upper legs, and around the vaginal area. You may also notice a rising strip down the middle of your belly. This is called the linea nigra and it marks the area where your abdominal muscles meet. When you are not pregnant, this is unseen line called the linea alba. The strip will be even darker after Bubs is born because your belly has shrunk. So imagine if you drew on a balloon with a black marker, then deflated it. The mark will fade eventually, but this can take up to 4 months or so. And what causes darkened skin during pregnancy? The anterior pituitary gland in the brain produces more melanocyte stimulating hormone or MSH, which is the same hormone that affects how tanned your skin can become. Skin tags during pregnancy. These are small, as in tiny pieces of skin that overgrow and can occur anywhere on the body. Skin tags occur more frequently during pregnancy because of the body's increased metabolism. While they can be annoying and unslightly resist breaking them off as they may bleed. Most skin tags will disappear as mysteriously as they can during the first 3 to 4 months after the baby is born. If some do not and you find them annoying, your doctor or dermatologist can usually remove them for you after this time. Freezing them off is the most common way of doing this. Feeling warmer than usual during pregnancy. The increased blood flow through the skin during pregnancy makes most pregnant women feel warmer than usual. The amount of blood flowing through your body starts to increase at about 6 weeks gestation, so that by about 32 weeks it can be as much as 50% more than what it would normally be. This increased blood flow combines with the relaxing effects of the pregnancy hormones progesterone to make the tiny blood vessels in the skin surface or capillaries open up more. The capillaries become more filled with blood, often referred to as vasodilation, making the pregnant woman feel warmer, even heated or flushed at times. Sweating more than usual during pregnancy. Pregnant women tend to sweat more. This extra bodily treat occurs because during pregnancy, the skin sweat glands work overtime. This can happen day and night and continues for many women who breastfeed. Salt lost through extra sweating is possibly thought to contribute to leg cramps in the hotter months.